Now I want you to hear the man who runs our public health system, the largest public health system in America by far, and a place where heroic work was done to protect New Yorkers from COVID. My pleasure to introduce Dr. Mitch Katz.
Oh, thank you, Mr. Mayor. And most importantly, thank you from before my return to my hometown. You saved health and hospitals by providing a large influx of dollars when times were really tough. And I think COVID has shown how well an investment that was. And we saved lives. At the height of the epidemic, health and hospitals tripled the size of our ICUs to accommodate ventilated patients. We pushed to our limit, but we never faltered. Indeed, we took patients in transport from private hospitals to save lives. Along with our sister Department of Public Health, we led the largest test and trace initiative in the United States. Again, our tracers saved lives by enabling people to isolate safely, including in our 4 isolation hotels. We picked up patients at their homes, we got their medicines for them, we walked their dogs, we did whatever was necessary so they would not infect others. And then most recently, Health and Hospitals has played a critical role in vaccination. We vaccinated over 1 million, we did over 1 million vaccinations, and our data show that we were much more effective at vaccinating people of color than the private hospitals. And that's because we are the trusted provider for immigrants, for the Black and brown communities, for the Asian and Pacific Islander communities. They know they're safe with us, and that we provide quality care to all without regard to immigration status, ability to pay, race, ethnicity, gender identity, or sexual preference. And now, sir, with your leadership, it's time for us to take additional steps to keep our patients safe and to keep each other safe. Although we all wear masks at health and hospital facilities, we know that the Delta variant is incredibly contagious. And we know that vaccinations work in preventing people from getting sick with the Delta variant. So starting August 2nd, we will be asking all our staff to protect their patients and each other by taking one of 2 steps that you've outlined, sir. All of my staff will need to get a COVID vaccination, or if they are not vaccinated, to test weekly to be sure that they do not transmit COVID to our patients or to each other. We know in healthcare facilities that there are patients at high risk for COVID due to underlying diseases. Some of these patients are immunosuppressed and cannot mount an adequate response to the vaccine. Some of our patients are young children who are not yet eligible for vaccination. We need to protect them and each other. We will work collaboratively with our labor partners to make it easy for our staff to be vaccinated or easy to be tested weekly. Testing will be at our facilities so that our workers can be tested on their work shift. We hope that the example of our healthcare workers protecting their patients and protecting others will, Mr. Mayor, as you said, inspire others in the private sector and other public sectors across the country to take the same actions to make sure that we are protecting our patients and each other. Thank you, sir.
Thank you so much, Dr. Katz. Thank you for what you and all your colleagues at Health and Hospitals do for all of us. Look, here's the key point. The folks who protect us are healthcare heroes. 600,000 or so in New York City alone, 1.2 million in New York State, 22 million in the United States of America. This is how this gets very serious very quickly. What we're seeing from national studies is around 50% of healthcare workers are vaccinated nationwide. 22 million. That's 11 million people right there who should be the first, most important priority to get vaccinated. Here's a way to do it. So again, urging every public and private hospital, starting in New York City, but everywhere else, this is the first step in fighting back. Everyone can do this now, and everyone should do this now to save lives.